Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Thank you so much for being here today. Today's episode is going to be all about snapping hip syndrome, or sometimes this is just called dancer's hip. So this is a topic that people have requested a couple of times recently, and it's something that we see really commonly in the clinic. So today I thought we would dive into what is snapping hip syndrome, why do we see it more in dancers, why is it called dancer's hips often, and then what we do about it, some treatment options if you are a dancer or you have dancers who are potentially experiencing snapping hip. So I think some of you or a lot of you are probably familiar with this, even if you didn't know sort of what the name of it was or the terminology of it. But snapping hip syndrome is essentially a clinical condition or a clinical presentation that is characterized by either palpable, so that just means you can feel it. So either somebody putting their hand on your hip or just while you're moving your hip, you can feel it, or audible, so you can hear it, reproducible snapping sensations that happen in the hip with specific hip movements. So again, it's palpable or audible, reproducible snapping sensations in the hip with repeated hip movements. So I'm sure if you are a dancer, you automatically are like, oh yeah, that sounds familiar. I kind of know what you're talking about. So it is a condition that is really common in dancers. And so even in the general population, if people go to a doctor and they're experiencing this and they're looking for a diagnosis, the doctor may diagnose them with dancer's hip, even if they've never danced in their life. It's kind of the same as people who have lateral epicondylitis, like an elbow injury. It gets called tennis elbow, even if people have it from not playing tennis. So this is really commonly referred to as dancer's hip. In some of the literature, and again, we don't always have great studies in dance populations, but in some of the literature, rates are as high as 80% of dancers having experienced this at some point in their dance career. And obviously the rates are much lower in other populations. And it's maybe somewhat unsurprising because generally snapping hip syndrome is an overuse phenomenon. So it tends to happen with repetitive movements or repetitive overuse of the hip. So dance checks that box. And then the position of the hip where snapping hip syndrome is most commonly occurring, or the positions most commonly associated with it, are hip external rotation, so that's turnout in dance, and then hip abduction above 90 degrees, abduction, and that is essentially anytime we extend our leg over 90 degrees, especially to the side, so Alice-Acon positions. And if you've ever experienced snapping hip before, or you have dancers who have experienced it, that should be also a little bit of a light bulb moment where you're like, oh yeah, this is definitely much more common when you're doing something with your leg in second. So either doing a développé, a grand battement, any sort of kick, those types of things. So those are the positions where we most commonly get the snapping phenomenon happening. And so it's no surprise that this is a really common thing we see in dancers, because those positions are positions we're in all the time. So other sports and other athletic populations don't use those hip positions quite as often potentially. And so, like I said, this is referred to as dancer's hip, just as kind of a lay term for what is actually called snapping hip syndrome. There are two different types of snapping hip syndrome, or two different sort of categories of it. And they occur slightly differently in terms of the presentation and the movements and positions that sort of bug people. And the first type is what we call external snapping hip. So this is happening a little bit more in the outside or the external part of the hip. And it usually involves the iliotibial band, so the IT band, and that's a band of fascial tissue that starts up at the outside of the hip, kind of by the the iliac crest, so the top of your hip bone, and runs all the way down the outside of your thigh and attaches in to the knee area in through there. So it usually involves the IT band, and where it crosses the side of the hip joint, the top part of our femur that attaches into the hip joint, there's a little bony prominence, or like a bony bit that sticks out that's called your greater trochanter. And oftentimes what can happen is that IT band sort of snaps back and forth over that greater trochanter and can cause this snapping hip syndrome. Occasionally, I'll talk more about that type of it in a second, but occasionally we will also see snapping hip syndrome that happens, external snapping hip syndrome that happens in the back of the hip. And so the IT band one is usually people will report it being kind of more on like the outside of the hip, or the side of the hip is where they'll feel it happening. We can also have it happening at the back of the hip. And in that case, it would be the hamstring tendon, so proximal hamstring tendon, where it comes up and attaches into the pelvis, and it would be rubbing or snapping back and forth over the ischial tuberosity, which is your sit bone in through there. That hamstring snapping hip syndrome, I would say I do not see nearly as commonly in dancers as you might see in some other sporting populations. So with that particular hamstring sort of posterior snapping hip, you see it more commonly in maybe runners and things like that, and we don't see it as much in dancers. We do see it sometimes, and if we see it, it tends to be when dancers are in more extreme ranges of motion in terms of hamstring flexibility. And actually, the people I see it in more clinically in my practice are actually my circus artists. So especially aerial artists, if they're, inverted and doing things where they're coming into sort of pike type positions and something, or like those types of positions, they will sometimes report that they get this kind of snapping sensation in the back of their hip in those positions. Like I said, I tend not to see this type as commonly in our dance population, but we do see the IT band type more often in the dance population. The other type of snapping hip syndrome, the other sort of category, so we said that those are external snapping hip syndrome. The other type is what's deemed internal snapping hip syndrome, and that is most commonly from the hip flexor muscles. And so people are going to experience this much more in the front of the hip. Sometimes people will even report that it feels like it's really deep inside the hip. And this is most commonly from the psoas or the iliopsoas tendon and it rubbing over the front of the pelvis in through there, or from the rectus femoris tendon as well, kind of rubbing in the anterior part of the femoral head or the pelvis, depending on where the snapping or the rubbing is coming from. So that would be what we call more internal snapping hip. So it's the hip flexors. It tends to be more anterior. It's important to note that people can also have snapping or clicking or popping sensations that are actually happening from inside the joint itself. And so when we're talking about snapping hip syndrome, we're talking about tendons or sort of muscle tendon units sometimes that are rubbing or snapping back and forth. But a lot of dancers will come in and report that they're getting clicking in their hip or clunking or popping or other sorts of sensations. And in those cases, it could be happening from within the joint itself. So what we would call intra-articular, so in the joint. And that can be from other lesions that are happening. So it might be a labral tear. It might be an instability in the actual femoral head in the socket. It can be from other things. So when people are coming in and reporting kind of things like that happening in their hip, it's important that we do sort of a good assessment to figure out where this is coming from. Some amount of clicking, popping, cracking, whatever sort of sensations that we feel or hear in the hip, some amount of that is common in dancers and really probably common in anybody who's using their hips in extreme ranges of motion. So whether that be people doing martial arts or yoga or other activities like that as well. The difference with what we would deem snapping hip syndrome, or where it becomes problematic or when we become concerned about it, is when, like I said, it's this reproducible, it's happening all the time with specific movements. It's not just, every once in a while, or oftentimes you get people who the first grand plie of a class, they'll feel their hips kind of crack or something like that. And then it doesn't happen again for, the entire rest of the day or even for a few days or whatever. So those cases are different, and we're not concerned about those cases of the occasional noises that the hip joint is making. But in the case of snapping hip, it's that reproducible characteristic of it that makes us more interested in it or potentially more concerned about it. The only reason I bring this up is, because people get confused about whether it is a snapping hip syndrome or whether it is more of a popping in the hip or things like that, but also with the internal snapping hip syndrome, so that's that iliopsoas tendon or potentially rectus femoris tendon, there's about a 50% kind of correlation or comorbidity or whatever you want to call it of people who have that and then also have some sort of intra-articular lesion going on. So whether that is like a cyst or a labral tear, or there can be a whole host of things going on within the joint itself, but there is definitely an overlap or a correlation in those two populations of the internal snapping hip and the intra-articular lesions. So it's just worth being aware of, because if we have somebody who's coming in with anterior or internal snapping hip, we want to also then be assessing for, okay, what is the stability of the hip joint like? Are we concerned about a labral tear or things like that as well? So those are our two kind of main categories of snapping hip. So we have our external, which is more IT band or potentially hamstring at the back of the hip, and then our anterior or more rectus femoris or potentially or iliopsoas tendon in through there. What are the causes of snapping hip syndrome? Well, we talked a little bit about it being an overuse thing, and in most cases, it is an overuse injury and overuse in those particular movement patterns. So external rotation, hip abduction above 90 degrees, and then repeated flexion extension as well. So just that nature of hip overuse is one of the potential causes. But we have lots of dancers who are doing those same movements over and over and over again as well, and they never develop snapping hip syndrome. So what makes some people potentially more likely to develop it than others? There can be some correlation with people's individual bony anatomy. So we talked about how the actual snapping that's happening is the tendon rubbing back and forth over like a bony prominence. So in the case of the IT band, it's that greater trochanter. And in some people, just their bony anatomy and how they're designed, they might have a more prominent greater trochanter than other people may have. So automatically they're going to be a little bit predisposed potentially to developing a snapping hip syndrome. And it's not just the greater trochanter. There can be other just bony structures associated in the pelvis or the femur or anywhere within that sort of hip complex that might make somebody more susceptible or more likely to developing snapping hip syndrome. We see this clinically very, very commonly start to develop when female dancers are starting to go through their adolescent growth spurt and starting to hit puberty, because their pelvis starts to widen as one of the adaptations that is happening. And we've talked about this previously on other podcast episodes, where when we are growing, and especially when we're going through those periods of rapid growth, our bony skeleton or our bony structures generally or often grow faster than our soft tissues do. And it takes longer for the soft tissue, so whether that's muscle or tendon or even ligaments and things like that, to grow and to lengthen and to stretch out. So in those cases, we will often see snapping hip syndrome sort of developing because the geometry of the pelvis has changed. It's potentially widened a little bit, but if the psoas tendon or the IT band or any of those structures haven't lengthened at the same rate, they're going to be relatively tighter and then maybe potentially more likely to rub or snap back and forth when we're going in and out of these repeated movements in through there. So there are sometimes, in terms of those bony structures, that could be a more sort of quote unquote permanent thing, like you just have a more prominent greater trochanter. Or it could be a more transient thing, like going through a period of rapid growth, like adolescent growth spurt, and having that widening of the pelvis, in which case it is probably a more temporary bony cause of this snapping hip syndrome. We most commonly see snapping hip syndrome being a result of something getting too tight, and therefore it's rubbing back and forth as opposed to being able to glide or slide back and forth sort of easily. So depending on the location of the snapping hip, we may find that those muscles or those tendons are tight and therefore rubbing. And when we're looking at sort of treatment options, we want to address that, but oftentimes something is getting tight because of a weakness either within that muscle itself or in another muscle surrounding the area. So it's not just a case of, and we'll talk about this when we talk about sort of treatment options, it's not always just a case of stretching out a tight muscle, because that doesn't always address the underlying cause. But generally, snapping hip syndrome, in terms of causes of it, it's that repeated overuse of the hip with some sort of an associated imbalance going on, and whether that's a weakness in muscle groups or tightness in muscle groups or in tendon units or things like that. We can also have people who just genetically, and again, this is just like their makeup and their own body structure, they may just tend to have shorter tendons. So some people have like much longer tendon units in their body, and some people might just like structurally have slightly shorter tendon units, in which case they may also be more susceptible or more likely to develop a snapping hip syndrome type of condition as opposed to other people. So those are just some of the causes, but really the underlying big cause is that overuse, and that overuse in some of those repetitive hip movements like the external rotation, hip abduction positions. This is also one of the reasons why we always harp on and go, sort of promote the importance of cross-training and promoting other movement patterns, because if we're only ever using our hips in those kind of repetitive external rotation abduction positions, we are more likely to develop overuse type issues in those movement patterns, as opposed to if we're spending a lot of time dancing with our hips in those positions, but then we're also cross-training and conditioning in other positions, so potentially in parallel positions or with our legs not above 90 degrees or things like that. That is one of the reasons why, especially for this condition, cross-training and promoting that is so important to try and prevent sort of the overuse causes of this. The vast majority of people who develop snapping hip syndrome report that it's painless when it first starts. And it's usually not until it becomes painful that dancers will actually seek out, attention or treatment or things like that. But we, in an ideal world, want to deal with this issue before it becomes a painful issue. So in the vast majority of people, this snapping hip sensation when it first starts, it doesn't bother them. It's just something they notice. Every time I do a développé to second, my hip snaps. Or if it's an IT band, sometimes it's just the action of going from a turnout position into a parallel position and back again. So that just like rotation of the hip in the socket from parallel to turnout, they'll get that snapping happening in through there. Or some people, it's like as they shift their weight onto a supporting leg or whatever the movement pattern is. But most people notice it happening before it ever becomes painful. And it's because that tendon is just kind of rubbing over that bony prominence or sort of snapping back and forth over the bony prominence. And that in itself is not generally problematic if that just happens every once in a while. But if this becomes this reproducible pattern where every time we développé to the side or every time we kick our leg to the side, this snapping is happening, eventually you're going to start to get irritation with that. So if you imagine the tendon being a little bit like like a rope or something like that that's rubbing along the edge of something, At the beginning, it's going to rub and it's going to be fine and nothing's going to happen and it can just like rub back and forth. But when that happens over and over and over again, you can imagine in your mind how you're just going to start to get like sort of like fraying of that rope, or it'll start to look kind of fuzzy, or just like there's a little bit of like wear and tear in through there. And that's essentially what happens in the body. Is if that snapping back and forth happens enough times, there's going to start to be some irritation, and whether that's like an inflammatory process that happens in through there, and that is commonly what is happening. It could be like a bursitis that develops where the tendon is, because we have those little bursa sacs everywhere in our body that are designed to deal with friction. But if that friction is happening over and over and over again, potentially those start to get inflamed and you start to get like a bursitis in and around the tendon area. It also could be these sort of partial tears or fraying of the tendon, so like a partial thickness tear. We talked about that last week. Was that last week? On the podcast when we talked about tendonitis or tendinopathies in dancers and the types of tendon injuries we can see. So ideally, we want to address this snapping hip syndrome before it gets to one of those stages where it starts to become inflamed, or you're starting to get any sort of like tearing or fraying or anything that is damaging or injuring the tendon in through there. So although when they are asymptomatic, most people just ignore them, we ideally want to get it looked at. And especially because when they first start and they're asymptomatic, they're often easier to treat if there is an imbalance that's going on that's caused this. So it is like, okay, we just need to strengthen some muscles and stretch some muscles and whatever it is we need to do. That can sometimes be easier to do at the beginning when it is not painful. This becomes a much more difficult or a trickier condition to treat once it is painful, because once it becomes painful, we then have to work on calming the tendon down or the muscle or whatever it is that is generating the pain or that is irritated. And that can sometimes be really, really challenging because tendons, as we talked about in that tendonitis episode, they don't have the greatest blood supply necessarily. So once they start to become unhealthy tendons, it is much harder to get them back to a healthy state, as opposed to if we have an asymptomatic snapping hip, it is much easier to deal with the root cause of that issue before the tendon ever becomes painful. So all of that just to say that if you have a dancer or are a dancer who is experiencing this and it is, that reproducible, either palpable or audible click that happens every time you're doing a specific movement with your hip, please, 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 please go get it addressed before it becomes a painful hip condition, because it's so much easier to work on before then. And I know that this is the type of thing that dancers oftentimes will report to their teachers. So dancers will be like, oh, when I feel like, or when I do this movement, I'm feeling this in my hip. And teachers will often, potentially ask, oh, is it painful? Or, they might ask some questions about it. But if it's not bothering the dancer and it's not stopping them from doing anything, oftentimes teachers don't necessarily recommend having it addressed because it's so common in the dance world. So teachers are often used to hearing this report from dancers, and so they may be familiar with the condition themselves to some degree, but oftentimes their response then is, oh yeah, that's dancer's hip, or that's really common, or we all, go through periods where that happens, or things like that, which is, a fine answer, sort of, but we also then want to encourage the dancer to actually go and get it addressed before it becomes a much more difficult problem to deal with. So that's my little PSA for the day. If you're a dancer or a dance teacher and you have dancers who have snapping hip, please, please, please have them get it addressed before it becomes painful snapping hip. But in the cases where either it starts out painful, and in some cases there won't be that precursor of an asymptomatic stage, it will just straight away present as a painful condition. Or in the case where maybe a dancer didn't have it addressed when it was asymptomatic and now they have a painful hip, what do we do about it? So one of the biggest things with snapping hip syndrome is activity modifications. So we want to try and avoid the snapping as much as possible. And for that exact reason, like I was just talking about, that when it first starts out, if it's asymptomatic, the tendon's probably not that irritated. But if it continues to snap back and forth over and over and over and over again, we get that low-level irritation happening in the tendon. So we want to avoid that snapping position or snapping movements as much as possible to decrease the number of times that that tendon is being irritated. And especially because the nature of these is that they're often reproducible, that's usually pretty easy to do in the sense that we figure out the positions that are the ones that are bothering the dancers. And especially for the case of like that anterior snapping hip, oftentimes it is to the side, so to second, and when your leg is turned out and your leg is going above 90. And if that is the case, then sometimes the modification we make is as simple as we're going to keep your leg lower. Maybe we keep it at 45. Maybe if they keep their leg at 45 temporarily, it never happens. And so that's a pretty easy modification to make temporarily so that we're avoiding that snapping sensation. In a lot of instances, we need to modify how much turnout they are using. And this is true for the anterior tendons, and this is also especially true if the snapping is coming more from the IT band. We will often need to modify. So instead of them using their full turnout, we might need to have them pull that back, and maybe they're working at 75% of their turnout for a period of time. So those are probably the two most common modifications that we'll have to make, is lowering the height of leg and extensions and limiting the amount of turnout. But essentially, from an activity modification perspective, what we are trying to do is prevent that snapping from happening or avoid the snapping from happening as much as possible. That's not to say we're going to avoid it 100% of the time, because dancers are still going to go into positions and feel it happen occasionally. But if we can go from having it happen 50 times in a class to happening 4 times in a class, that really decreases like the threshold of irritation in that tendon. So we really want to try and avoid the snapping as much as possible. Then we want to address the muscle imbalances that are happening around the hip joint. And the most common thing that I see in the clinic is dancers who come in, and this has been going on for a while, and maybe it started out and it wasn't sore, then it started to get sore when it was happening, and they feel it in the front of their hip, and it's, it feels like my hip flexor is, the thing that's snapping, and feels tight all the time. And so they've been stretching it a lot. They're like, I've been stretching my hip flexor every day and doing all of this hip flexor stretching, and it's actually not helping. And in a lot of cases, it's making it worse. So just because something feels tight doesn't necessarily mean that it needs to be stretched. And especially in the case of this anterior snapping hip, stretching our hip flexors will often make it worse rather than better. And the reason for that is that one of the biggest causes of like the imbalance that we see around the hip joint is the hip flexor itself has gotten tight because it is weak. And so if we keep stretching it out, it's going to keep tightening up because it was doing that for a reason. It was tightening up as a protective response. So oftentimes what we actually need to look at is learning how to isolate and recruit and strengthen our hip flexor muscles. And especially if we're looking at getting the height of our extensions up in dance. And this is one of the things that we see commonly in dancers is they're not necessarily super great at isolating their deep hip flexor muscles. And so oftentimes they'll end up compensating by potentially tucking their pelvis underneath a little bit or gripping with their quad or all sorts of other movement patterns that show up. So one of the first things that we're doing with people with snapping hip is teaching them to find a neutral spine position and then be able to isolate their hip movements from their pelvis and spinal movement. So just being able to do a simple hip flexion movement without the pelvis or the low back moving is really where we often have to start with these dancers. But stretching our hip flexors is often counterproductive. And really what we often need to focus on instead is strengthening those muscles and making sure that we're strengthening them in ways that aren't with kind of compensatory movement patterns. Now, that being said, everybody often feels a lot of tightness and it just feels like it needs to be stretched all the time. And sometimes there is a muscle length issue in through here. But I would say more commonly than not, doing some sort of myofascial release or trigger point release or manual hands-on therapy or potentially, rolling or things like that are often better ways of dealing with some of the tightness that is happening or discomfort associated with the tightness rather than doing a lot of stretching, because the stretching is often a little bit counterproductive, and more often than not, the tightness is there because of an underlying weakness. So isolating hip flexors and learning how to really move the hips independently of the lumbopelvic junction is super, super important. And then looking at other muscle imbalances around the hip. So the other thing that we see really commonly with these snapping hip syndromes is that the dancers are often weak in their glute muscles or just not using their glute muscles efficiently. And if they're not using their glute muscles efficiently, then other things are being overworked or other things are being stressed and then potentially tightening up and causing this snapping sensation. So we're often working on a lot of glute strengthening or potentially even just glute recruitment to start with so that we're addressing that muscle imbalance. And in a lot of cases, it's glute max. And so dancers, again, because we work so much in a turnout position and we maybe don't work a lot of just like parallel hip hinging squatting movement patterns, dancers may not be using their glute max super efficiently. And then sometimes it's more obviously glute med or glute min that aren't working as well as they should be or aren't as strong as they should be. And that those weaknesses, the more glute med or the like kind of more lateral hip weaknesses, those ones tend to be more associated with the IT band snapping syndrome. And the glute max weakness, I would say, tends to be more associated with the anterior snapping hip syndrome, just from clinical experience in terms of what we see in the clinic when we're dealing with dancers. So addressing the muscle imbalances around the hip, but that does not necessarily mean just stretching things out. More often than not, that means working on strengthening and recruitment patterns and muscles. That is key for treating these in conjunction with avoiding the irritating movement patterns. And then the third kind of critical piece of addressing these and treating these is going back and looking at and retraining some of our foundational technique in dance. So going back and revisiting, just coming up into a simple passe pattern or maybe développés or whatever the movement pattern is that dancers are struggling or are getting that snapping with, we sometimes need to go back and retrain those movement patterns, because it's often the case that maybe dancers have developed these minor little compensations or sort of cheat patterns and things like that over the years. And that has contributed to these imbalances that have developed. So it's not always enough just to address the actual muscle imbalances going on in that area of the body. Sometimes we then need to actually go back and retrain some of our foundational movements. And it could be as simple as going back and looking at pliés or things like that, like really basic stuff, to make sure that those movement patterns aren't feeding into any of these imbalances and how those kind of developed in the first place. So that is just a little bit of a snapshot of how we would work with a dancer who is dealing with a snapping hip. The good news about these, I don't know if that's really the right way of putting this, but the positive is that the majority of snapping hip syndrome doesn't ever turn into a super serious injury. Very rarely do dancers need time away from the studio entirely. It's very easy to control snapping hip syndrome with just avoiding some of the more irritating movement patterns if we catch them early enough. So the key with that is that we want to deal with the kind of clinical presentation before it becomes symptomatic, and then we're dealing with a really, really angry tendon, which then takes a lot longer to deal with. So the earlier we can deal with them, the less severe they are, and we often then don't need to take significant time away from the studio, if any at all. Most dancers can just continue dancing with this as at the same time as addressing the underlying things that have potentially contributed to it. All right, that is what I have to say about snapping hip syndrome, or dancer's hip, for right now. If you have any questions or want clarification on any of that, please let me know. I will try over the next few weeks to potentially post some videos of some exercises that we might use for hip flexor isolation, glute recruitment, things like that. I am going to be traveling, so no promises that it's going to happen immediately, but keep your eye on my social media, especially my Instagram channel, because I will, over the course of the fall, kind of make an effort to post a bunch of that stuff so that you can see what some of the things that we might use from a clinical perspective are to address some of these imbalances in snapping hip syndrome. But in the meantime, if you have any questions, please reach out. Let me know. My email is in the show notes. You can also reach me on social media at DancePhysioErika. Thank you so much for listening today, and I hope you have a great rest of your day.